So today we're going to talk about the Pain Tech SI joint fusion procedure. What I'm going to walk you through initially is going to be the instrumentation that we're currently using. This is the third generation of the instrument, and fortunately, we were one of the first practices in the country to be able to use it. There's a couple key things that they have changed from the previous rendition. The guide pin is one example. And the initial guide pin was actually a pretty sharp tipped guide pin. And now in the kit, they have both the sharp tipped one. Additionally, they also have the blunt tip guide pin. The reason I find this really important during the procedure is because it prevents me from going directly into the bone itself. It allows me to stay closer to the tissue and to the joint that I'm trying to penetrate. And so that is a bigger safety margin than we had previously. The next portion of this is actually the cannula. The cannula is a really important instrument because it allows us to actually keep the implant in place and all the tools that are going to lead us to the finalization of the implant. Another key part of the cannula is the way it looks on the fluoroscopic image. This is going to be a key image finding that we're going to discuss as I demonstrate the piece, where it allows us to see where the joints have lined up. And that's going to show where the implant is properly placed. The dilator itself has also been redesigned. It's actually a true dilator, and there's a huge safety margin actually built into it because it allows us to use this dilator and it actually finds the joint as we're penetrating it. The decorticator itself has been kept the same mostly, but a couple things have changed. One is the way the instrument itself completely works. And so this lever light right here has been added on because it assists in helping to remove and to separate the dilator. Finally, the insetter has been slightly redesigned as well. The grip on the implant itself is quite a bit stronger, so it keeps that in place. Additionally, it's set up so that when you're actually viewing it in fluoroscopy, it looks a bit different. The last thing that we did not discuss was the H-bar. The H-bar is actually a really unique tool, and where it actually comes into place is when you have all the instruments lined up and you need some assistance in helping to separate them. And so what happens is you actually take the H-bar and you can help use it to help separate the instrumentation. And this can be used both for the dilator and the decorticator. Next slide. So these are called surgery-ready instruments. The reason this is the case is because no longer do we need to wait to get these sterilized and prepared for surgery. They actually come pre-packaged this way. And this is really important because one, you know that it's coming from a safe designated location where everything is prepared according to appropriate standard. Secondly, the ergonomics have been quite a bit improved as we've already discussed. There's a significant cost savings as well because we don't have to keep preparing and keep going back and re-sterilizing the old tools that we were using. Finally, there are quite a bit of safety implants that have been built into it. So like we talked about the guide pin and the dilator, the distal tip is actually tapered, so which allows it to be tissue sparing and creates a shallower insertion. Next slide. Finally, the value of surgery-ready instruments. So we already kind of touched on this. You know, the two models up here kind of show what the reusable option was, where you would prepare for surgery, and then potentially if the surgery got canceled or delayed, you'd have to sterilize and then go through that process again. The single use is basically completely predictable. It's available as you need it, when you need it. And so that's really the biggest win for us, especially in terms of how it's been designed and used so that it can be predictable in its instrumentation. Hi guys, so this is the lab demonstration of the procedure. Now, like we talked about, there is a lot of emphasis on appropriate fluoroscopic imaging. This is really going to guide the appropriate placement of the implant itself and to ensure all the safety parameters that we're going to take in place. So what I'm going to have my X-ray tech do is first begin with an AP view of the cadaver. Okay. Next, really our goal is to get that river view. What that means is that we really want those joints to overlap on one another, so it shows us where that opening's at. And you can see that this cadaver does a really beautiful job in actually helping those joints to line up. Perfect. So once we've identified that, for demonstration purposes, I've already marked it on this cadaver, but we take instruments that show that come out to be radio opaque and show where that line is at. Okay. At that point, just going to make sure that we're drawing out where that joint is so that we have an appropriate visualization. Okay. Come about halfway in the middle of the joint because that's typically where you want to go above the bifurcation for the insertion of that guide pin. At this point in my patient, I'm going to go ahead and actually numb up and anesthetize the skin. Once I've done that, I'm going to make a stab incision here. Now, typically in my patients, what I've found is that if I use a spinal needle and to actually come up with that trajectory using the spinal needle, it actually helps to facilitate the guide pin. For our demonstration today, I'm just going to use the blunted tip guide pin just because of its increased safety margin. So once I get a little bit seated in the skin, I'm going to use the mallet to kind of drive it a little bit forward. Picture. All right, perfect. So I like where it's placed there. Now I'm going to move to the lateral view. Now, as my tech is getting this in the lateral view, my scrub tech is going to actually provide me with the next part of this. Okay, so we know that we've already actually penetrated the joint just like we want, and it doesn't need to go much further than that because the auto-correcting dilator does a wonderful job actually making sure that it goes in the right place and at the same time it spares the tissue in the process. So like with the old instrumentation we were talking about, the letters always go lateral. And again, because of the way this instrument has been redesigned, because of the auto correction feature, we don't actually need to go back and to get the tines to be viewed on the imaging. So at this point, we just mallet forward. Okay, now just we need to be a little bit mindful of where that pin is moving. Okay, sometimes with the cadaver, it's a little bit harder to demonstrate that, but we just need to be mindful of that. Okay. And you can see that it's doing a beautiful job actually auto-correcting into that joint. Perfect. So I like where we're at this point. Okay. Now, a couple of things, kind of what we talked about using the H bar. Sometimes, at this point, it can be a little bit difficult to separate these instruments out. And so this is where the H bar actually comes into play. Okay. You can use the H bar to actually help penetrate this and to help separate these two instruments. All right. The next part is that we can take the pin out. Okay. Now, once we've taken this pin out, we need to actually go back and get that hollow point view right down the barrel. Okay, so what I want to do as my X-ray tech is doing that, it's going to be using suction to take some of that blood, to take any potential blood out. So that is a pretty good image there, but that is the ideal image. And if you can get that image, that tells you that every single time you're going to be putting that implant in, it's going to go exactly where you need it to go. All right, the next point, okay, is we're going to use the decorticator. Now, again, there is a channel in the decorticator here, so it helps to facilitate this. Perfect. So we're back in that lateral view, okay? Perfect. And you can make micro or auto corrections here as you need to, just to help facilitate this better. Perfect. So I like where we're at right there because it shows that we are between S1 and S2, and that's typically the ideal placement for this. Now, a couple of generations before this, it was taught that, you needed to come in perpendicular each time. And truly, the instruments have been changed and modified a little bit to show that the implant itself doesn't need to be coming in perpendicular every time. That's really not what actually causes the magic of giving patients that pain relief. It's just the fact that it helps to separate those joints at the appropriate level and then later on to go ahead and actually cause fusion. So those are the things to keep in mind. So in some situations, because that joint is so versatile and it may be that you might have to come in more parallel than perpendicular, that shouldn't really throw off that what we are doing is actually still getting it in the joint at the right level. So at this point, you actually end up having to take the decorticator out. Okay, and this blue lever is really important because you need to kind of keep some grip on this black lever here and then use the blue lever to help insert it and to pull it out. At this point, At this point, my scrub tech is going to actually hand me the implant. Now, the implant we're just using for demonstration doesn't have the demineralized bone matrix, but one thing I want to keep in mind here and to point out is the large window. This window is really important because of the amount of dBm that we can actually keep in there. That dBm is important for two reasons. First, the key part is that initially we're getting some of this pain relief because of the distraction that this implant is causing. Secondly, that with time, with the DBM and that large window, it's actually going to go ahead and form a fusion of that joint. And so those are two ways by which this instrumentation, this technology helps to alleviate pain and to stabilize that joint. So on fluoroscopy, as you can see, that we have the ability to actually change the instrument a little bit as needed so that we can get it exactly where we need it to go. So this is in an ideal placement between S1 and S2. At this point, you would just simply take out the inserter, take one more picture there, and then finally, you take out the hollow tube. Perfect. And so you can look that in the lateral view, the implant is exactly where it needs to be. And we're going to go back to the AP view where we started at just to have another confirmation, and that's ideal placement. And so I just really wanted to end with this final picture here. This final picture, you can say that a picture has 1,000 words, but only three come to mind, right? It's opportunity, it's simplicity, and it's hope. Hope for our patients, opportunity for our patients for a better quality life, and finally the simplicity. I mean, simple technologies solving bigger problems. And that's really it, guys.